Flu season is here, just starting really in Spokane, but already more than a dozen people have been sent to the hospital because of it. Good evening. Thanks for joining us. I'm Nadine Woodward. Spokane Regional Health District tells us so far this season no one has died from influenza in Washington, but there have been 16 hospitalizations in Spokane County alone. Also, there has been one influenza-like illness and one influenza A outbreak reported in long-term care settings. So what does this mean for the rest of the flu season? KXLY4's Grace Ditzler working for you, and she has the answer. Grace?
Nadine, the Spokane Regional Health District says this means that the flu season has come early this year. Another concern they have is this vaccine might not be as effective on new mutations of the virus that people are already getting. And the CDC took samples of the flu strains all over the country and found about half were slightly different than those that were seen in the vaccine. So that means for people that get the mutated strain of the flu, they'll only be partially protected by the vaccine. The Regional Health District says that doesn't mean it's not going to work, though. It just might not work as well as it has in the past. And the health district says we're still in the early stages of the flu season, and there's no way of predicting how severe the season will be, so getting a flu shot is still your best option for protection.
It's really important to get a flu shot even despite this news because for one reason, that component of the flu vaccine is only one component out of 3 or 4. So if we see other types of influenza circulating, which we often do, then they're going to get full protection there.
Ann Springer says the flu season usually hits Spokane the hardest around January or February. So if you haven't gotten your flu vaccine, you still have time to do so. Nadine?
What happens now that the CDC knows the vaccine isn't as effective? Are they going to come up with a new one?
Right. I'm told that they will come up with a new one, but it takes 7 to 9 months to make a new strain or new vaccine that will better combat this strain, and so it won't be ready until next year. Reporting on the Skydeck tonight, I'm Grace Ditzler, KXLY 4 News.
All right.